Tell me about shock treatment.
ECT, as well as electroshock therapy, also called electroconvulsive therapy, has been used for many years, and I was exposed to it right during my nurse's training during the 60s, and I participated in this as a ECT therapist until the late 90s. Electroshock therapy was given in state hospitals to numerous patients. Usually the average that we would do would be 3 times a week. On the unit where I was, probably 20 to 30 patients. Patients went to it willingly and freely. They had to sign for participating in this therapy, and we made it very comfortable for them. They had individual, very soft beds. We gave them a pre-injection of a medication that helped them relax, and you had to administer the electroshock therapy while they are during this relaxed period. Following the treatment, and I will later describe in detail actually what happens to the human body. Following the treatment, we would get the patients up. We would feed them juices and cookies, because usually we avoided feeding them before the treatment in case there could be the possibility of aspiration. I have to admit that I participated in treating hundreds of patients with electroshock therapy, and I have never seen a very serious complication. At all times we had all types of resuscitation equipment near the patients in case we needed to use it. However, during my experience, we have never had to use it. Following the electroshock therapy, patients would be somewhat confused, usually after the first treatment less. After about 3 or 4 treatments, the confusion period would increase. It would last a little longer, but they very quickly came back to their normal persona. After I left the state hospital in the late 60s, I participated in administering this treatment to a number of patients in a general medical hospital, and I found it interesting that many patients would fly in from the East Coast to be treated by a friend of mine, a physician that was extremely competent and knowledgeable in this therapy. They would be admitted under a medical diagnosis in order to avoid stigma, and they would be treated with the electroshock therapy, and they would, maybe after the treatment was over, check into a hotel for a few days, after which they would fly back, usually to the East Coast, to their very well-paying employment.
I think most people are familiar with electroshock used as a punishment, particularly in the famous scene from the movie One Flew Over the Cuckoo's Nest. Have you ever seen it used as a punishment?
I have never seen it used as a punishment, and in fact, I was usually in charge of preparing the patients for this while I was a nurse at the state hospital. And we would talk about, I would make sure that they emptied their bladder. I made sure that they hadn't eaten recently. I made sure that their dentures were removed, that anything that could make them uncomfortable during the treatment was removed. And often I would just take them by the hand, and we would discuss exactly where they're going, what is going to be done, and how they will feel when they come out. It was also, electroshock therapy was also commonly used for what was at that time termed as postpartum psychosis, which a lot of people are familiar with, is a type of depression that sets in after somebody gives birth. And I have seen a number of mothers that came into the state hospital for shock treatment following the arrival of their children, and go home within a week or two to a very, very satisfactory life.
Why do you think shock treatment has such a negative implication?
I think the term, I think it sounds horrible. I think it was depicted in movies and also in writings as a type of punishing therapy. And when you think of, as it describes, ECT, electroconvulsive therapy, okay, number one, you have electricity going through the body, and the patients have convulsions. They're usually well controlled, and you can anticipate, what the behavior is during the convulsion. You make sure that all possibilities of injury are avoided.
Do the patients remember anything about the treatment process?
Yes, they do. And in fact, usually on treatment day, when I came to work, they'd say, "Is today treatment day? Are we having our treatment today?" And they would actually line up to go, because we would bring them in one at a time into the treatment room. And they came absolutely willingly. I never can remember anybody being forced into this type of therapy.
What are the potential risks involved?
The potential risks, or what people are thinking, is they could die. And, that is, of course, human nature. Any intervention where you are kind of unaware of what's happening to you, people are afraid that they could die, or their memory could be permanently erased, which is not the case. And to my knowledge, this treatment is still being used.
What kind of conditions is it used to treat?
Often people that return to the fetal position, they will not eat, there is no response. All psychotropic medications that have been used have not caused any improvement. It's usually the last stage, and it is usually not spoken about.
How long does the treatment last before you might need another?
And I have experienced people to come in, particularly people as outpatients, every couple of years for a treatment of about 3 to 4 treatments. They would usually let us know, "I think I'm okay now. I think maybe I need 2 more or 1 more." Patients were very free to participate in the decisions of how many and when to return.
Thank you very much.